politicians are having to deal with. We need more data so we can make better decisions.
Okay, so we don't have enough data to make these decisions then. So that's kind of, the way I look at this right now, since we don't have all this data, it's almost it's like flipping a coin and say, should I or shouldn't I? Okay? And some people are going to be, like I say, some people are opposed to it, some people are not opposed to it. So really, health, it's kind of in your own hands, isn't it? It's kind of in a sense. Is that?
It is. It is. You have to make decisions that you feel are best for you, and consider the pros and the cons, the risks and the benefits. Consider your particular situation, the factors that you're exposed to, the environmental influences, your genetic susceptibility. Mm-hmm. We feel that the effect of the vaccine probably depends on genetic and environmental influences. Mm-hmm. So those need to be considered, and those interactions between the genetic and the environmental influences, the relationship between them and the effect of the vaccine with those is just unknown because the studies haven't been done.
Mm-hmm. So we need to go back and do some case history then. In other words, say as an example, a patient comes in and both parents are diabetics or they have allergic reactions to things, they have a lot of sensitivity to heavy metals or food or what have you, okay? And they have this child, okay, that is going to get this vaccination, regardless which one it is. Then there's a real strong possibility that they're going to have some adverse effects. That's what I'm hearing from you.
Well,
okay?
They're relatively more likely.
Okay.
Those children are relatively more likely
Sure.
to experience an adverse event than other children without those allergies and a history
Sure.
of other problems.
But since the vaccinations are just so massively done and everybody just gets them, in other words, when you go into school, you have to have a vaccination
Right.
for this particular thing and for this particular thing.
Right.
And they're just giving them the vaccinations and they're not really looking at, well, wait a minute, now both of your parents are both diabetic. So maybe we better consider you. So in other words, it's a pretty...
We don't have the data, though.
Yeah.
Those children may be at greater risk.
Sure.
But it's those factors that we need to study more.
I understand.
The interaction of the vaccines with history of diabetes and other influences that the children are exposed to.
Sure. Because some people just say you need to do it and you just have to have this vaccination.
Right.
Say,
right
well,
now, it's basically universal vaccination. Everybody gets vaccinated, no matter what their risk profile is.
Well, that's kind of scary, isn't it, in a sense?
Well, maybe we need to do more selective vaccination. Mm-hmm. But the problem with that is we don't have the data to know who's at greatest risk for the adverse events.
So in other words, the pharmaceutical companies then really haven't had any studies done on this, or they haven't put out the finances to go ahead to find out about this thing.
Right. Well, there's no incentive for them to conduct these long-term studies.
No incentive as far as meaning there's just not enough money there?
I don't want to speak for the pharmaceutical companies, but suffice it to say, they're not expending the resources in this area.
Right.
And from a public perspective,
sure.
From a societal perspective, it would be nice if they or someone else did.
Well, it seems to me that they're possibly going to have to start spending some finances on finding these things because, you know, with today's health, and you know yourself being a scientist, I mean, we're in the year 2000 and people are just now questioning a lot of things, where maybe 30, 40 years ago, they weren't questioning things like, say, vaccination or what have you. Now they want answers. So maybe we're going to force these pharmaceutical companies into going ahead and doing some research because people now want some answers about their health.
Well, 30, 40 years ago, they weren't questioning it because the childhood illnesses were much more prevalent. So vaccines came into the market, and they had a good effect on reducing the incidence of those childhood illnesses.
Perfect. Well, listen, Dr. Hurwitz, you gave us a lot of information today. It's pretty controversial, the way I see it, and there are risks, and there's things that we should consider before we do get some vaccination, okay? And it seems to me that people that are at high risk, like maybe diabetics or lower immune systems or people that have these particular problems, then really should consider this a little bit, maybe should talk to their doctor about even getting these particular vaccinations then? Would that make sense to you?
They should be aware of the potential risks.